Baby boomers are expected to need more in-home care as they age. The government estimates employment of personal care aides who provide non-medical assistance will grow 26% between 2014 and 2024. But federal investigators are now raising an alarm over what they call persistent fraud and abuse in Medicaid-funded personal care services. Estimates of questionable billing since 2012 total more than $600 million. Anna Werner is here with a story you will see only on CBS This Morning. Anna, good morning.
Good morning, Nora. Investigators from the Department of Health and Human Services Office of Inspector General are once again criticizing Medicaid for not cracking down in this area, saying the government needs better regulations to prevent patient neglect and fraud cases like the one you're about to see.
The woman on this video taken by investigators said she needed a personal care assistant because she rarely left her house and could hardly walk.
I crawl.
You crawl.
Sometimes it's even on my elbows.
But agents caught her dragging a waste can across her driveway and picking up her dog. Investigators said Medicaid paid for 5 in-home care workers over 3 years for services never provided. The woman and 3 of the workers were charged in connection with the fraud and given jail time. David Cerrone is a special agent with the Inspector General's office.
So we've got actually fraudsters out there who, they bill for services that weren't rendered.
Today's advisory highlights other examples, like an attendant in Illinois who submitted claims seeking more than $34,000 for services that she did not provide, and another in Missouri whose timesheets indicated she was in 2 places at the same time. But worse than fraud, says Cerrone, is patient abuse and neglect.
We found various instances of abuse where individuals were supposed to be getting one-on-one care with personal care attendants, and the attendant didn't stop by for weeks on end. Cases where attendants went on cruises in the Caribbean and the beneficiary was left alone in their home.
The problem, he says, there are no consistent standards for personal care workers nationwide, which is why the Inspector General's office is recommending minimum federal qualifications and screening standards for workers, including background checks, state registers for all attendants, and better tracking of services provided. In response, the Centers for Medicare and Medicaid Services told us the health and well-being of Medicaid beneficiaries is a top CMS priority. We are actively strengthening the program's protections for beneficiaries and taxpayers.
This could be somebody's mother, it could be somebody's father, it could be their grandmother, their brother, their sister, and they're trusting that care is being provided to an adequate level, but it's really not.
CMS says it's working on specific steps, including training for states in monitoring fraud, waste, and abuse. But the OIG points out it issued a major report on all this in 2012, and no major changes have happened as of yet.
Well, if we're lucky, we'll all get old, and we may need help one day. How do we even know where to go, Anna? There seems to no way to know who's qualified and how to track it.
Yeah, you really have to do a lot of checking, Gail, onto the agencies. What are their requirements? Do they have real background checks? What kind of experience and qualifications do these people really have? And we've talked to some people who've had some problems, and it's tough.
You have to hope the children like you still. You're not going to say, "Who's your turn to take care of Mom?"
Will and Kirby, I am moving in with you, right?
Yeah, like I said, it's your turn. Thank you, Anna.
Just hope we get old.
That's right. That's right. I said if we're lucky, we'll all get old. Thank you, Anna.